With our aging population and patients living longer, we are seeing an increase in vision-threatening cataracts. A cataract is when the lens inside the eye becomes clouded, preventing light from entering into the eye and requiring surgical removal.
Cataract surgery, again, has become such a great procedure that the results have been quite amazing. And it's amazing how technology continues to push the envelope here. And in Canada, we're very blessed. I mean, I think any Canadian citizen has access to high-quality surgery with great outcomes without having to pay anything in terms of out-of-pocket. You know, our provincial insurance plans cover very good surgery and very good lenses. We also have the benefit of having refractive options, where we see sort of a combination of being able to remove the cataract and enhance one's vision beyond what a basic lens can provide. For example, enhancing vision at nighttime, what we call sort of aspheric optics, enhancing the optical clarity and the quality of vision beyond what a regular lens can provide. These are things that most governments have deemed to be something that's optional for patients. They're not necessary, but patients can choose to select those specialty lenses if they choose to pay out of pocket. We have testing that can be used to enhance the precision of surgery. And why is that helpful for certain patients? A patient may wish to, for example, reduce the need to wear glasses. They may wish to get out of glasses. Well, in order to do that, we need to be as precise as possible using a variety of different testing options to measure the eye, the front of the eye, the back of the eye, the length of the eye, the curvature of the eye, the optics of the eye, in order to pick the right lens implant, to size it right for their eye, so that they may be able to see without glasses for far away, for example, or even in some cases for far and near. So these are all extras, if you want to call them, or specialty devices or specialty tests that are not covered by the government, and probably for good reason, because I think every citizen should have the right to very good care. And if you wish to have further lifestyle benefits, whether it's reducing spectacles, reducing glasses or contact lenses, or treating astigmatism, for example, which is where the shape of your cornea may be shaped more like an oval than a round soccer ball, it's more like a football. We can fix those by using special lens implants that can enhance a patient's vision without glasses. So I think it's very important for patients to know their options. And there are a lot. It can get confusing. Taking the time with your eye care provider, both the optometrists have a great role and ophthalmology as well, to be able to counsel patients and educate patients. People are not only living longer, they're active longer. We see people that it's amazing how active our patients are. And I routinely operate on 80-year-old patients, and they're very active. I tell my patients that this is going to be a decision that's going to be there for the rest of your life. These lenses are going to last longer than you are. And so choose wisely. Choose something that's going to match your lifestyle. It's not a quick decision. It takes a lot of time to digest all this information, to talk about it again, and be aware of the choices. And I think we're very privileged to be in a time now where people have choices for lens upgrades and for testing options that really allow us to push the envelope. We often give them a specific number of websites that we know have been vetted out, that they have good balanced information, and it can be very helpful, for example, to simulate what the different options can provide to patients. And I often encourage patients to sit down with families. Often patients can't see very well to be able to understand all of it either. So, it's often a group decision made with a spouse or with a family member as well. Ultimately, the patient, should make their own decision. But I think the internet can be very helpful, used in a focused way.